Okay, so welcome back to the show. Flint Geier here as always, and really excited to have a special guest with us today, coming out of, where in Utah are you again?
Delta.
Delta?
Yep.
Delta, Utah. When I think Delta, I always think of like the Delta in Mississippi. But have Dr. Daniel Funk joining us from Delta, Utah. So Dr. Funk, thanks so much for joining me today.
Yeah, thanks for having me.
My absolute pleasure. So, so we first had a chance to speak. Gosh, it probably was like September maybe of last year. Does that sound about right? Something like that. And somebody's breaking into the studio right now, but we're just gonna keep going live. You know what I mean? So, Dr. Funk, for the people listening, like, tell me a little bit about you, your practice, kind of like how you got into dentistry. Like, what's the Dr. Funk as the dentist origin story?
Yeah, well, how I got into it, my dad's a dentist,
Okay.
but that actually kind of deterred me at first. I was kind of like wanted to pretend to be the rebel and not do exactly, what my dad did, but he roped me into assisting one summer and I got the bug, man. It was pretty cool. He was doing some pretty artistic work and I liked it. So that's what got me interested. And, I worked with him for a year out of school. That was great. I ended up moving to Texas for several years, and worked down there for like a DSO. And then now, just recently, within the last couple years, moved back home to Utah. More of like a lifestyle move and being close to family. But so in private practice with my partner, Dr. Bloomfield. And yeah, that's kind of the origin story. Did you want to
Okay,
know anything
that's
else?
that's funny. So, okay, so your dad was a dentist, and you're like, yeah, I see that, but I'm gonna go do something else. So, what was the original thought? Like, was there another path that you were like, I'm not gonna do this. Forget that.
It wasn't that creative, man. I was thinking medicine.
Okay, yeah. I
Yeah,
still want to be a doctor. I'm just not gonna do the exact same thing as you. Cool.
right. Yeah.
Okay, that's awesome. Okay, so you got in. You kind of you say you got to see some artistic work being done. So, what was it about that drew you to the profession?
Well, yeah, just along with that, I felt like there was definitely some job satisfaction there. Like just seeing that, it was pretty satisfying to see the outcomes he was getting. So yeah, I liked that part of it. So
Yeah,
yeah.
no, makes sense. That right. It's fun because we get to work with a lot of doctors or doctors and their kids that either their dad was a dentist or both of them are in the practice, and obviously, right, like I get to have that experience. And I was kind of like originally had the same thought. Like I saw what my dad was doing, and I was like, yeah, I don't really think that's for me. I really don't think that's going to be the move. And so like in college, probably two-thirds of the way through, I was still pretty convinced I was not gonna end up uh, doing what my dad did. And I was like, wait a minute, it's actually pretty cool to see what happens to the people that we get to work with and like impact people, right? So it's
Mhm.
funny, a little kind of correlation, right? You saw the artistry in that, and that's funny. But we all end up where we end up. So
Yeah. Yeah.
fantastic. Okay, so families from Utah wind up in Texas working for a DSO, and then kind of return to the homeland, if you will. And so, been in practice with your partner now for how long? You say a couple of years?
About a year and a half.
Okay, year and a half. Okay, that makes sense because you were probably about a year in when we first had a conversation.
Mhm.
Okay, love it. So, tell me a little bit about that transition from like being in the DSO, where I assume there's, they have kind of structure and process and everything, and then moving into private practice. What was that like? Or I guess what, how did it meet your expectations or not?
Yeah. Um, Definitely a lot of pros and a lot of cons there. Um, for sure, like some of the pros are like like a lot more flexibility in time. I was doing 5 days a week in Texas, and coming here now I'm doing 3 days a week. So that's really awesome. Um, and then, um, but yeah, at the DSO, I was like, okay, you're not really responsible for anything except for the clinical.
Right.
And so it was really, you know, pretty laid back. Like, between patients, you just do whatever you want, and there's really no extra work to be done at the end of the day. Just get everything done, and you clock in, clock out, essentially. Um, but yeah, here a lot different. There's a lot of work, in addition to the clinical side, um, leadership aspect of it, and just getting, making sure everyone's trained up and firing on all cylinders, essentially. So, that's the responsibility of the owner, and um, that transition has not been easy, and I don't think I'm good at it at all. So, um, you know, just trying to figure it out.
Yeah. Yeah. Well, what's so funny? It's like the people who will say, "Hey, I don't think I'm good at it," like that's actually pretty important. You know what I mean? Like, because what's great is there's somebody out there who's going to listen to this and they're going to be thinking, well, what's wrong with this guy? I'm amazing at leading, and everybody thinks all my ideas are perfect. But the reality is they're just like totally lying to themselves. So I do think part of that transition of, hey, I'm going from essentially being an individual contributor, right, as a doctor in a DSO, to now obviously being in an ownership position, like how do you think most doctors handle that transition? Because I feel like in all the conversation I have, it's pretty similar to what you're describing, as opposed to it just being smooth and easy. And
Man, I probably don't talk to enough doctors about it
mm,
because I really don't. I mean, it was tough. Like part of the hard part for me is we had like a very narrow niche at the DSO. We were doing dentures and implants primarily, and then coming here, I just opened myself up to doing restorative, pedo, um, ortho, a lot of different things that I hadn't been doing for essentially 6 years. I had done it a little bit with my dad, but in his practice. So yeah, that clinical transition was rough, but even rougher than that has been, people are looking to you for decision making and leadership, and um, yeah, it is like it's just kind of rough when you like don't necessarily know the answer, and if you come up with some answer and maybe it's just not the right fit for the team, and you kind of have to go back to the drawing board. Yeah, it's a tough transition, but um, I I think it's worth it over the long term. So we'll see. But
yeah,
so far it's been fun. I'm not trying to say it's been too rough, but yeah,
yeah. Well, I think
some challenges there.
that's the reality of it, right? So I think, the point you make of I probably haven't talked to enough doctors about it. Like I certainly don't think you're the only person who's in that position, right? So we got to meet for the first time in person, I mean, I guess almost a month ago at the event out in Phoenix, right? And I mean, you remember, we're in that room and there's probably 10 other docs there, and I asked everybody the question, "Hey, how many offices have you been in?" Right? And do you remember like the cumulative number of practices everybody in that room had actually stepped foot in?
It was like microscopic.
Yeah, I think it was like maybe 40 among everybody, and one person had 20. So they were like the whole room, right? So,
Yeah.
I do think that is kind of the norm, right? So versus like when you guys had your first training in November, right? Who do you remember who did your first training?
Oh man, um, don't remember his name.
Okay, well, it was a guy, so that
It's a
narrows it
guy.
down for me.
Yeah,
So it's
there you go.
Carson, Doug, Ray, Dave, maybe. I don't. Was he British?
Oh,
Did he
I
have a
want to say
British accent?
Carson. That kind of rings a bell. Yeah.
Carson, darker hair, short.
Yep.
Okay, yeah. So it's probably Carson. Carson's great. Fun fact: I used to carpool to school with Carson many, many years ago.
Cool.
But anyways, fun fact. Okay, so you get in there, and then Carson comes in. Carson's been in like 750 offices. Okay, like just think about that contrast, right? It's like, okay, well that might be interesting. So we first had a conversation. You were kind of going through that process, right? You were a year end of having to the ownership process, and it's like, hey, I feel like we need systems and we need some consistency. And like, how was that first in-office training experience, right? So obviously something that you hadn't been through before, but really it's something that a lot of doctors and a lot of team members don't really have the experience in it until you do it, right? It's like anything else. So like first time we're going in, doing a training, not talking about anything clinical, right? What was that like? Like what was the setup, and maybe how did the team respond to that first time?
Oh yeah. So, I think overall very positive. Um, I personally was excited to have some clarity on like what we need to be doing for
Yeah.
that specific topic, answering the phones. Um, and so that was exciting. I think, as far as like pushback from the staff, I think that was I don't think that was necessarily like apparent during the training. The training was very good. I think one thing that was super impactful with the training was calling neighboring dental offices around, and after you kind of get a concept for like what a phone conversation should be
Mm.
when a new patient calls in, you get a concept for that in the training, and then you start calling these other offices, and it's like night and day. Um, it just makes you super excited to like offer that level of customer service and like customer focused call
Yeah.
that so yeah, that part was really cool. It kind of like, you know, got us hooked in a way to where it's like, yeah, this is going to be awesome.
It's great.
And then, the accountability part, maybe that was a part where it's like, okay, here's where we're all going to be kind of working as a team to get this implemented. And so, I was excited about like some way of like holding, this system accountable and like seeing results that way. And so that was a little bit uncomfortable, but like knowing that we all kind of agreed that this was a good thing,
Mm.
even kind of like just kind of helped us work through the kinks of like, trying to get everyone certified.
Yeah.
So,
Yeah. I mean, it's interesting, right? That balance of we're here for the training in the moment. We're like, yeah, that all sounds great. But how we respond to the accountability that follows it is always interesting, right? So it sounds like that's going well. And I know I've had a chance to speak with a couple of your team members on some of the call-in days, and they seem pretty engaged in it, which is great, right? And obviously, I was pulling some of your stuff before we got on, and 3 months in, I think we're doing pretty well. So we were started off about 39 new patients a month, kind of the 12 months before that training. And since then, you guys are averaging like 48, which is awesome. So we just want to keep that momentum going, right? So I always like to ask this question, right? So like when we first spoke, right? If I were to say, hey, Dr. Funk, in 3 months, right, you're going to be averaging 23% more new patients a month within those first 90 days. Like, I probably said something like that to you, if I'm being honest. But, like, did you really believe that was going to happen, or were you just kind of hoping it would?
it was a hope, man.
Yeah.
I mean, without like seeing it happen, it was just a hope. Yeah, I didn't totally believe you at first.
Yeah.
but good job, you got it right.
But hey, yeah, right. But it's so fascinating, right? It's like it's the same thing when you present to a patient. And you're like, hey, this is gonna get you feeling better. Like it's gonna look amazing at the end, but they don't really believe you until the results there. So I just think that's always fun to look back and be like, hey, if I had told you on day one that this was going to happen, would you even believe me? And it's like the answer is almost always no. But it goes to your willingness and your team's willingness to do things differently to get a different result. So I commend you guys in that. Okay, so sounds like the team responded initially pretty well to training. How did it go when that additional layer of the accountability came in, right? So was there any friction, or was it more kind of frustration because you've got a team of people who just really want to do well? Because I think those are two different problems.
Yeah, so we had, I think more than frustration, there were like kind of some questions about
Mm-hmm.
some of the process, but just kind of going through it myself, kind of seeing what they're asking. And then also the Q&A calls have been really helpful because, Megan has, been able to get on those and get our questions answered. But like, um, anyway, there were a few things where it's like, well, what do they really want us to do? And um, they're holding us to this high standard. And I would just say, listen, like, it's such a better call than what we were used to. Like, it's so customer focused, like, especially the dual alternative. Like, yes, like, there's kind of like a dichotomy to it. Like, yes, it's a quick call, um, but it's also like all about them
Yeah. What was
as the
the
patient. And so,
biggest?
like,
So do you think that was the biggest mental shift for you guys of like, hey, we don't actually have to spend 5 to 10 minutes in a conversation with a patient to give them great service?
yeah, I think that's just like huge for, those people who are working in that position to be able to like free up a little bit of time, have something so like clear cut, focused, effective. Um, and so yeah, I think that part is really cool, a great aspect of it. So yeah, I think it's very difficult, and like in just talking to them, they wanna um like there's little parts where it's like it's tricky to like get that verbiage right, but as they work on it, like it's just getting better and better, and so yeah, it's,
Yeah.
it's really cool.
Yeah. No, and I think that's great, and I think you're kind of. I always say I think the people who do the best, right, is where the team takes it and runs, but the doctor is going to defend doing it that way, right? So I always tell people, hey, if you just give us 3 months of doing it the way that they get trained, like then we look back and we judge the result. You know what I mean? And so you guys are now at that point, and obviously we look back and it's a 23% increase, and hey, that's great, right? But now, right, like I know that also creates a new list of challenges and opportunities. So like, were there any uh, un I guess unforeseen or like new problems that popped up once the new patient flow started to increase? Like, how has the response been with the rest of the team with that?
Yeah, there've been I think a couple, maybe like one kind of minor issue, and then maybe one that's a little bit harder to overcome. But like initially, like kind of our intake of new patients was kind of one way, and now we're changing that just to be more like accommodative and make it easier for the you know people who are talking on the phones to like have capacity to get them in, because that was like an initial bottleneck. And then the other big bottleneck is hygiene. If someone calls in for a cleaning, it's kind of booked out, so we're trying to grapple with that. And but yeah, those are some of the issues.
Yeah, right. Which now, and I know we've talked about this, but it's like, okay, great. how we diagnose those issues, right? Patient comes in the office, they got something going on. Well, how we diagnose it's super important, right? And the same thing I think is true with this. And I feel like you guys have been kind of taking those in stride, and it's like, okay, great, we got a new problem. Let's diagnose it appropriately, right? And then go and find the solution to handle that. So I think that's, number one, I want you to hear like you're doing the right things and you're responding the right way. And while it doesn't always feel awesome in the moment, right? It's a slow burn to it to keep that going long term. Okay, so 2-doctor practice, got a little bit of a hygiene capacity constraint, right? First thing we came into was phones. Then I guess just last month you guys did the new patient experience training. So how was that? Like, how did the team? What was the response to the actual like? Here's what we're going to change about the in-person process with the new patients, because I know sometimes that can be, we involve more people, and how'd that go?
Yeah, I think that one was a little more. I think that one's a little more exciting because it's more team involvement. With the phone calls, it's like, yeah, we're all here, but like, only like 4 of us are going to be on the
Yeah.
phones. So, but yeah, the new patient experience was fun to, just kind of like brainstorm how to make the experience better. And so yeah, definitely some more engagement there. But along with that, probably a bigger checklist and, a little bit more legwork to get it implemented. We're kind of in the middle of that right now. So yeah.
Yeah. Yeah, there's a lot that comes out of that day, right? Because once you start to really dissect what the patient is seeing, hearing, touching, feeling, right? And it's all those things that, we just kind of get blind to, right? It's like I walk through our office and I see the same stuff every day, and somebody walks in for the first time, they're like, what's that? It's like, I didn't even notice that, right? So, no, that's good. I think that's a fun one because we get to like all kind of, it's like a little secret shop action. Okay, awesome. And then I know y'all have your case presentation training coming up soon. So that'll be kind of like that third piece in the foundation, which will be awesome. Just building on the progress you guys are making, which is great. So I guess walk me back, through that transition, right? So if maybe I'm a doctor and I have my eyes on leaving an associateship or a group practice, and I'm like, man, I think I want to go do my own thing, right? In your 18 months of being in that position, like, what would your advice be to that doctor who's considering or maybe on the verge of making that change?
Yeah, I mean, one thing that kind of triggered our decision to look into some training was just like actually getting realistic with like the results we're getting. And like one thing we looked into, not a lot, but like just listening to a few phone calls. Like, when we were initially like listening to a few phone calls, it was like, man, like I know we could be handling these phone calls better,
Mm.
but like going along with that, and this is kind of like one of those things I run into a lot, like in business in particular. It's like I know there's an issue, but I don't know like the answer
Mm.
like right away.
Yeah.
And so that was kind of like our thought process originally. It was like, man, let's get some phone training. I looked at like, non-dental specific, non-medical specific customer service phones thing. And it was like kind of going into their offerings. It was like, this really isn't like, I'm sure it'll help us, but like not like maybe be so specific to like what we're actually needing.
Yeah.
Um, so yeah, did that answer your question?
In a way, right? So, I mean, what I'm hearing is if I'm a doctor and I'm looking at getting into practice ownership, like there are going to be things that I was not professionally trained to do or to answer the questions, right? So you go to school and you learn how to diagnose and solve the problems with what's going on in somebody's mouth, but in running the practice, and you just tell me if I'm repeating what you said the right way here, uh, you're gonna see some problems, right? But you may not be as equipped to diagnose, okay, great, this means I need to do this and change that and fix this. Is that pretty close?
Yeah. Yeah, like you like once you transition into the ownership, you'll realize like there's there needs to be like um you need to be a leader for like a system, and if there's not a system, it's just so person dependent that
Yeah,
you better have some good people there to, you know, help you out. But
yeah.
that's also another issue. So
I think that that point is so big, right? Because a lot of people I feel like will get into, they'll get into an office and there will be maybe a team member or two, right? And then it's like the lockbox of all information, right? And
yeah,
well, Susie knows everything and can do everything, and that's awesome until Susie decides that she's done working, you know? And then all of a sudden, all those processes go away, and you're kind of left on the hook for all of that. So, no, I think that's great. Um, okay, so you've mentioned leadership a lot in our conversation, um, and I know, right? Obviously, we were just talking. You're speaking with my brother this morning and talking about some coaching for yourself. So, like, a lot of people train their teams, right? And say, hey, you know what? Let's get a system for them. Let's make sure that they know what to do, right? But it's a different, acknowledgement to be like, hey, I want to make sure the team's set up for success and they have systems and tools and things to help them be successful. But like, I also think I need to look at my role in this, right? So what prompted you to say, hey, love what's going on with the team, want to keep training them, but actually now I also want to look into getting coached myself?
yeah. I mean, you alluded to it before. It's like you go to dental school and you can do all this dentistry, but if you're owning a practice, there's a lot of other skills and um, like essentially like you need to have more answers
Mm,
to more problems like that. So yeah, I mean, the team coaching is a big piece, but also like I mean, I was just talking to Dr. Bloomfield the other day. It's like we like an issue gets raised and we're like, okay, like how are we gonna solve this? And we'll like kind of brainstorm some ideas and then nothing's like totally clear on what's the best way to do it. And then if you don't make a decision right then, I mean, we're both busy. So it's like,
yeah,
all right, either we either made a decision and you hope it's the right one, and sometimes it's not, or you didn't make a decision, and that's probably worse than not making like a bad decision. And so that's kind of that's been a little bit of like, I don't know if you call that like a bottleneck, but like something where we're kind of coming to the realization that like, if we don't resolve certain issues, like um, we've got some of our employees starting to like get a little bit demoralized by like, having to do extra work that, you know, maybe maybe they're like an A player and they feel like they're getting taken advantage of or whatever. Um, and so, yeah, I think like our focus has been on recently just kind of figuring out how we're going to lead this practice. If we're going to grow, it's going to probably compound like hopefully our bottom line, but also it'll increase how many issues are coming up and probably the rate of those issues coming up. So we need to have like some sort of like decision making process and hopefully some systems to kind of handle that.
yeah. No, I think and it's interesting. It parallels, I think, a lot to just like life, right? It's like the older you get, the more problems you have, like just period, I think. At least that's what everybody keeps telling me. Uh, the older you get, the more complicated your life gets, the more problems you have. But the crazy thing is the problems, like, because you learn through that experience, right, and get surrounded by people who have maybe dealt with it, or you talk to people who are older or whatever, like, it amazes me the amount of things that people can handle compared to what they could handle like 10 years ago, right? Just like as you watch someone age, right? And I think that process is the same when you talk about running the business of the practice, because you gotta, but the challenge is getting yourself around people who know how to solve those things or have already solved those things. And you're not in the echo chamber of the room of people who've only seen 20 offices in their life among 10 people, So I think that's great. Okay, well, hey, I appreciate you jumping on, and I'm so excited for the results you guys have seen so far, and look forward to continuing to kind of build on that momentum with you guys. But is there anything that any last piece of advice or thing that you would say to maybe a young doc who's, maybe they're unsure if dentistry is the path, but it's on the list, right? Like, what's your pitch for the profession?
Yeah, dentistry is crazy rewarding. So that is a that is a fact. It is challenging. It's physical. The student debt is out of control. But I also think like every challenge you have in life is, it's an opportunity, and you can grow from it, learn from it. So I do think, it's a challenging profession, no doubt about it, but I think it's worth it, and I like it. So go for it.
Awesome.
Do it.
I like it. Just do it, right? I don't know who came up with that. Just do it. Fantastic. Well, hey, what are you most looking forward to in the back, 2/3 of the year?
Man, just getting some traction, trying to solve the challenges, tackle the challenges, man. I'm excited for the growth.
Awesome. Good stuff. Well, hey, again, appreciate your time. Looking forward to what comes next. Dr. Daniel Funk out of Delta, Utah. Thanks for joining the show.
Thanks, Flint.